Hi everybody, today we'll be discussing liver injury grades according to revised 2018 American Association of Surgery for Trauma Liver Injury Scale. We have 5 grades. First, the grade 1. Each grade is divided into like laceration and hematoma. In the 2018 revised edition, they have included vascular injury also. Here the grade 1, we have a laceration and subcapsular hematoma. Laceration, that is a capsular tear less than 1 cm parenchymal depth, and subcapsular hematoma which covers less than 10% of the surface area. So in the examination you can draw a diagram and directly mention like this. When you are in a night duty, when you get a case of abdominal trauma, that is liver injury, how do you write in a report? For example, if you have a laceration, directly you can mention like there is an hepatic laceration with a 1 cm in depth in so and so segment. Suppose if you have a subcapsular hematoma, you can write directly a subcapsular hematoma, or you can mention something like elliptical hypodensity, compressing the normally enhancing liver, measuring so and so, located in width, adjacent to the width segment. Like that you can mention. So this is a grade 1. In grade 1 we have a laceration and subcapsular hematoma. Laceration is less than 1 cm, subcapsular hematoma is less than covering less than 10% of the surface area. Coming to grade 2, in grade 2 we have hematoma. We have a hematoma and laceration same. Here the laceration is 1 to 3 centimeters in depth. Capsular tear will be there, active bleeding will be there with which is this laceration is 1 to 3 cm in depth and less than 10 cm in length. We have both subcapsular hematoma and intraparenchymal hematoma. Subcapsular hematoma, it covers 10 to 50% of the surface area. Intraparenchymal peritoma, which is less than 10 cm in diameter. So if you have an intraparenchymal hematoma, you can mention directly contrast enhanced CT, that accident coronal images show. Suppose diameter of example 5 cm intraparenchymal hematoma, in which hepatic segment, you can mention direct. Coming to grade 3, we have a laceration which is more than 3 cm in depth. We have a subcapsular hematoma which is covering more than 50% of the surface area, or like ruptured subcapsular parenchymal hematoma with active bleeding. We have an intraparenchymal hematoma more than 10 cm, or vascular injury such as pseudo aneurysm or AV fistula, or there can be an active bleeding which is contained within the parenchyma. That is grade 3. Into grade 4, we have an parenchymal disruption involving 25 to 75% of the hepatic lobe, or we'll have a vascular injury with active bleeding. It's breaching the liver parenchyma and leading in and spreading into the peritoneum. That is grade 4. Coming to grade 5. Grade 5, something like parenchymal disruption is present involving, that is a laceration involving more than 75% of the hepatic lobe, or we have a vascular injury that is called juxtahepatic venous injuries. That is, it involves the central major hepatic veins and retrohepatic vena cava. This is grade 5. Normally, just remember, if there is any vascular injury, there is like pseudoaneurysm or AV fistula, on contrast enhanced images, it appears as a focal collection of vascular contrast. It decreases in attenuation on delayed images. If it is a vascular injury, it decreases in attenuation on delayed images. Even active bleeding will be like focal or diffuse collection of vascular contrast, which increase in size or attenuation on delayed images. This is active bleeding. So best thing in exams is to save the time, draw a diagram. Just drawing a diagram and labeling it is enough. You will get a good grades. Just that is the secret. Thank you.